Showing up for class, training graduate students in acceptance and commitment therapy. This study evaluated the impact of a semester-long ACT course on 10 clinical and counseling doctoral students at the University of North Texas. The course used mixed method learning by incorporating experiential learning as a substantial component.
The class met once a week for about 3 hours. We spent the first few weeks covering functional contextualism, basic behaviorism, and RFT. Then we transitioned to discussion of case conceptualization and therapeutic relationship from an ACT framework before covering the 6 core ACT components. Each class had 5 parts. We began the class by covering the previous week's homework. All homework came from the Learning ACT text by Luoma, Walzer, and Hayes. Sometimes students were asked to complete the homework assignments using a de-identified client or themselves for case conceptualization purposes. The majority of the class was devoted to assigned readings from a variety of books and journals on ACBS topics. These topics were covered in 4 ways: didactically and experientially, by the instructor and a student presenter. The didactic portion was guided by PowerPoint lectures, and sometimes it included in-class quizzes or question and answer sessions. Examples of experiential work included role plays, imagined exposure, drawing values, and using modeling clay to facilitate contact with the present moment. Informed consent and debriefing were conducted for these exercises.
Students completed an ACT knowledge quiz as well as measures of psychological flexibility and perceived stress at the beginning of the semester, at the end, and 4 months following the class. Appropriate to a college course, significant improvements were seen in knowledge of ACT principles over the course of the semester and maintained through follow-up. The hypothesis that psychological flexibility would increase over the course of the semester, however, was only partially supported. Reliable change index scores demonstrated reliable improvements in psychological flexibility according to the avoidance and fusion questionnaire for 3 students, which was lower than we expected. On the other hand, 8 students demonstrated reliable improvements on the difficulties in emotion regulation scale, which can be conceptually similar to psychological flexibility. No students demonstrated increases in perceived stress, which can sometimes be a concern in acceptance and mindfulness-based treatments that increase our awareness of emotional states. Not to mention, grad school can sometimes be perceived as stressful. Most students demonstrated no reliable changes in perceived stress, and 2 students demonstrated reliable improvements. More interesting to us, however, was the qualitative feedback that we collected 4 months following the class. We asked students what the impact of this class has been on their personal and professional development, and several themes emerged.
What did I find most beneficial about the course?
The experiential exercises were far and above the most helpful.
Definitely the experiential exercises and the opportunity to process those in a safe environment.
Those experiential moments in class where we got to maybe try some of the different techniques.
Experiential exercises and the opportunity to process that with Dr. Morrell and my classmates.
Someone being really well versed in it, teaching the concepts to us in experiential and lecture-based ways, but also being able to struggle with other people in integrating and grappling with the material.
We're really pushing people to delve into some difficult emotional work. So being able to actually feel what that was like on the other side and then see the exercises modeled was super helpful.
The biggest impact this class had on my worldview was learning to see clients and other folks I interact with on a daily basis within their broader context and coming to account a little bit more for what might be happening in their lives and thinking about the environment rather than attributing it to them.
It's okay to be silly in therapy.
I think what was a surprising element was that as I was learning about ACT, I found that it was not only helpful professionally, but it's a framework through which I I want to live my own life personally as well.
And not only has it dramatically affected my own comfort in my skin as a clinician, but it's also had a huge impact on my personal relationships.
Even just more on a personal note, to be more mindful and to just really be more present in the moment.
I think on a personal level, it meant that I started doing a mindfulness practice. I think on a professional level, I got hooked up in communities of other providers that are doing contextual behavior science. And it meant that I was reading and going to workshops to learn more.
Began to be more attentive to my contact with the present moment, to psychological flexibility in general, and to the degree to which I was fusing with certain concepts in my own life.
If someone were to approach me with questions about whether or not they should take this class or a class similar to this one, I would have to tell them that it has been one of the most rewarding courses I have ever taken.
Do it because it's different. Do it because even if you hate it, you're going to learn a ton.
I would tell another student interested in taking this class that if you have any interest in ACT at all, it would be well worth your time. You'll learn a lot, and it'll be one of the best classes you've ever taken.
Really learn a lot about yourself, not only in a professional sense, but also in a personal sense, and it just really helps you grow throughout the semester, so do it.
And be willing to, take risks.
But a tip of preparedness that I would offer is to be ready to do the work. It not only is intellectually challenging, but it's emotionally challenging as well. And I think it's really helpful for us to be able to get a chance to see and feel those aspects of the work personally.
Growing evidence for and popularity for ACT treatment increases the need for quality training. More research is needed on the impact of different training modalities and early academic training in particular, so we hope that other researchers are beginning to explore these same questions, and we hope to continue to improve upon our own methods. In particular, we had an emphasis on protecting confidentiality and decreasing the burden on already very busy graduate students. For this reason, we were unable to collect important information such as grade and other objective measures of competency. Future research would also benefit from multiple baseline data and comparison groups within and across graduate programs. Multi-institutional research in particular will increase sample sizes and generalizability. And on that note, please contact us if you have any questions or if you're interested in future collaboration. We're excited to hear from others who are also interested in this work.